Recently, at the Columbia University Club of New York, there took place an exciting social event organized by the Armenian American Health Professional Organization. The purpose of the gathering was twofold. First, to hear from AAHPO's members about their experiences from the 2015 medical mission to Armenia, which took place earlier this year, and second, to announce a new joint effort between the Armenian organizations AAHPO and COAF to bring much-needed medical care to rural Armenia for children and adults.
We are collaborating with COAF, and we went beginning of July, 6 doctors and 10 healthcare professionals, psychologists, dentists, pharmacists, and a lot of people, young people. And we work with COAF in their villages. There is a significant discrepancy between Yerevan and villages a few miles away, economic discrepancies, and also it reflects in medical care too. They are not getting good medical care. We had a cancer specialist who examined a young man with cancer, and he wasn't able to afford care in Yerevan. I mean, your heart breaks when you see situations like that. I, as a pediatrician, examined patients with asthma whose mothers didn't have the proper medication to treat their children. And a lot of kids undernourished, iron deficiency, anemia. So we are hoping to improve that condition in mostly rural areas.
The founder of COAF, Dr. Armen Garo, was among the guests.
You know, we are a small people. There aren't that many of us, and I think it's very critical that when we have professionals that we band together and pool our resources and fulfill our mission. And in the case of AAHPO, I think it's done a wonderful job of pulling the community's resources together and help Hayastan, which is very critical. And since my organization, COAF, does rural work, we collaborate with AAHPO to make sure that we can leverage our mutual resources to deliver the maximal amount of benefit to our people.
In a few words about COAF, where are you working on? What are the current projects where the organization stands?
Right. COAF was founded by myself and Alice because rural Armenia was in really neglect, and our rural people, contrary to most conventional wisdom, our rural people are very resourceful. They have fantastic capabilities. And we discovered that by working in a region, which was the Armavir region of Armenia, and just jump-starting the processes and allowing them to have the facilities that they need for education and healthcare, for social infrastructure, that the results were phenomenal. And now our organization is developed a formula called SMART, very symbolic, that will spread this capability throughout Armenian villages all over. And so I'll talk about that in a little bit as well. The reason we decided to take the responsibility of renewal in Armenian villages, because in 2003, during our first trip, there was nothing going on in Armenian villages. And yet, as Larry alluded to, the spirit of the people, the capacity of the people were phenomenal. Because, you know, we have this notion that Kuratsis are backward people. But in reality, our Kuratsis, and my grandmother was one, are very progressive people. And they have really been the critical elements of the diverse cultures that Armenia represents today. Without them, you would have a very monolithic society. And in fact, I keep on saying that without the villages of Armenia, Armenia could not sustain itself. So it's critical that we make sure as Armenians, you know, AAHPO's mission is clearly to gather all of the Armenian health professionals together, but beyond that, you have now made it a mission to really reach out to Armenians in rural parts of Armenia. And I cannot overstress the importance of that, because when we go to our villages, and some of you have been there, of course, our villages, the faces of the young people, the faces of our curatsis light up.
In a joint presentation accompanied with a slideshow, Lucy Tovasyan, MD, and Joyce Kurdian, DDS, spoke about their experiences from the 2015 mission. They described the medical facilities in rural Armenia that needed much improvement and spoke about the talented and dedicated Armenian doctors and nurses, which, despite the limited technological availability, continue to provide quality medical care for their communities. They also spoke about numerous patients they examine that require medical care that is readily available in the West, but still remains a challenge for many regions of Armenia.
This event tonight is basically to introduce to the general population our idea of trying to get a medical mission program started to bring qualified doctors from the States to come and help out and work with doctors in Armenia to help advance medical care, particularly in the villages where there is less access to adequate medical care.
AAHPO is a wonderful organization because we are involved both here in the U.S. and also in Armenia. We allow an opportunity for physicians and doctors and healthcare professionals to reach out to the community here. So if anyone has a question, they can reach through the website and connect and get services. And then aside from that, in Armenia itself, there is a great need for help, and we're forging all these connections so that hopefully over the years there'll be a sustainable medical mission program, continuing education program, and all that.
In the first part of his two-part presentation, Dr. Vahe Tateosyan showed heartbreaking images of facial burns and other birth and injury-caused facial abnormalities in children in rural Armenia. He spoke about the efforts of a team of international doctors and nurses, of which he took part of, to perform free of charge operations to correct these deformities. In the second part of his presentation, he spoke about telemedicine, an initiative he personally undertook to have a group of doctors from a kidney transplant clinic in Armenia watch live kidney transplant surgery performed here in the U.S.
The purpose of today's event is to begin a medical mission program, something that we've been talking about for the last probably many years. A number of us have started to go to Armenia years ago on yearly missions or biannual missions in order to not only help treat the Armenians in terms of children and adults in Armenia, but also to collaborate with the doctors there, provide education. We're starting not only to go separately, but we want to create a foundation, a network, a framework for other people to get involved and make it a little easier for other people to get involved and to set up a possible annual mission.
The president of AAHPO, Dr. Larry Najarian, in his closing remarks, called on all Armenian and non-Armenian medical professionals in the U.S. to join AAHPO's medical mission to Armenia in 2016.
Our hope for tonight is really just to share this wonderful news with our community and really help build a real supporting base. What's truly amazing about our missionaries is that they fund their own travel, all of their own expenses. So this is a total 100% volunteer effort. They take time off, typically their precious vacation time to go. For some people it's their 35th time, for some people it's their first time. But we want to really let people know that we're here, we want to help. It's totally self-funded. But when we get to Armenia, there are services that we would like to offer. There's equipment that we'd like to bring to really help deliver the best care we can. And that takes money. So we're looking forward to donations that help make this a very robust program that we know the Armenian community will support.
Dr. Najarian's remarks were followed with an engaging Q&A.
I absolutely love listening to them. They were so passionate about the work that they did. They made partnerships with other doctors in Armenia. They're teaching, they're open to learning, and they've done a good job. I look forward to hearing about their activities in the future.
This is an opportunity for me to learn more about mission or medical mission work in Armenia, which is something I've had an interest in, but have not done myself. My father was a retired physician who has been to Armenia multiple times and has participated in medical work there, and I thought this would be an opportunity for me to learn how I can participate as well in the future.
My impression from tonight is that we have some very dedicated people doing wonderful work in Armenia, and we need more volunteers to join them and expand our efforts there.
AAHPO is very important for the community, both here and for the work it's doing in Armenia. It's a vibrant organization, and it's important that the new generation of health professionals are joining it. It's amazing.
As the evening came to a close, the attendees, which included healthcare leaders, young professionals, and the Armenian community, had an informative and enjoyable evening. More importantly, all the proceeds from the evening went to support AAHPO's mission to serve Armenians in the U.S. and Armenia.